When it comes to Ebola, the first thing you need to know is that dying from the virus is like something out of a horror movie. It's extremely painful and terrifying. First you get a fever, then uncontrollable diarrhea, then you begin hemorrhaging blood. And while all that's hitting you, you lose touch with reality and become delirious. Finally, within days, you are dead.
They're busy spraying down the area where the person is. They're going to wrap in plastic and take away. But I was talking to someone in the community, and they had someone sick here yesterday. They didn't think it was Ebola. They thought it was something else, and they called for help, and no one came. They called again, and no one came. And not until he died, a 37-year-old man, not until he died did they come. And then they called, and within 1 hour, the burial team is here. This is a place right now where if you die of Ebola, they're very quick for you. If you're living and you need help, there's really nowhere to go.
West Africa is currently in the midst of by far the worst case of the disease since it was first discovered in Africa back in 1976. This year's outbreak has been traced to a 2-year-old boy who died on December 6th, 2013 in a village in Guinea. He probably got the virus by eating contaminated food that had been drooled or defecated on by a bat, or, as is common in this part of the world, had eaten some bat for dinner. Bats, researchers believe, are the carriers of the disease. As if the 2-year-old's death wasn't tragic enough, a week after it killed him, it killed his mother, his 3-year-old sister, and then his grandmother.
Outside the John F. Kennedy Hospital in Monrovia, Liberia, 20-year-old Ibaga Stiwo is sick.
Brother, what would you now?
His parents wait beside him. All signs point to the late stages of Ebola, the deadly virus that's killed more than 2,300 across West Africa.
He just vomiting, he toiling, vomiting, toiling, he eat, he vomit. Don't let him get a paper back.
As sick as he is, he won't be allowed inside. The largest hospital in the nation, and many others just like it, are completely full.
But I want to tell you, any hospital now will go to the same month. They say we should wear the title should come.
This is Ben C. Solomon in Monrovia, Liberia.
In 1976, the year of the first documented Ebola outbreak, a British scientist named Geoffrey Platt, researching the disease in a lab in England, accidentally stabbed himself with a syringe containing the virus. As the unmistakable symptoms of Ebola set in over the next few days, the British government acted swiftly. Platt was transported in a special ambulance, under police escort, to a London hospital where he was the lone patient. He was kept in an isolation chamber, and all hospital staff working on his case were quarantined, as was his family and any lab workers and friends he had come in contact with. The extreme action worked. Platt recovered without infecting anyone else.
This city of 1.5 million is the first major metropolitan area to face an Ebola outbreak since the virus was discovered in 1976. Hundreds have died here since the outbreak began in May, and the World Health Organization expects thousands of new cases in the coming weeks. With a limited number of hospital beds and personnel to treat the sick, many of the infected are left to die at the hospital gates.
It's heartbreaking. There's nothing I can do about it because I have no space, I don't have the capacity.
Local and foreign-run treatment centers alike are unable to cope with the surge. Here at the Doctors Without Borders Treatment Center, they too are at capacity.
But the current incarnation of Ebola is threatening to overwhelm the much more economically challenged West African region. Answering the call to action, the United States military is taking the lead in overseeing and coordinating the response to the epidemic. In addition to U.S. Centers for Disease Control and Prevention staff who have been there for weeks, President Obama has ordered 3,000 American troops to West Africa to build 17 100-bed treatment centers and a site capable of training 500 healthcare workers a week. The U.S. response is worth an estimated $750 million over the next 6 months. The Bill and Melinda Gates Foundation has alone donated $60 million, and the foundation of Paul Allen, Gates' co-founder of Microsoft, has given nearly $12 million. The American-led international response may come just in time. as infection levels were spiking exponentially in the middle of September. If no help had come, some experts were fearing the disease could have overwhelmed the region and spread until it exhausted its host population, killing hundreds of thousands or even millions of Africans, all the time increasing the odds that it could make its way off the continent. The World Health Organization now optimistically hopes to control Ebola by mid-2015, limiting the death toll to around 10,000.